The Quinnipiac University Frank H. Netter, MD, School of Medicine Rural Psychiatry program plans to train the next generation of psychiatrists who are future-oriented and focused on serving rural and underserved populations. One of the benefits of our program is that we have the backing of a world-class medical school with wonderful training sites at multiple community settings.
Fairfield County, Westport, Bridgeport, those areas where St. Vincent's is located, it's a more kind of busier, more richly diverse urban setting. And here at Charlotte-Hungerford, it's it's a little smaller hospital, moderately sized, and it's a community hospital in a rural setting. So getting that kind of mix of both places, I think, is very special.
We are striving to educate the highest standard of psychiatric practice in our upcoming residents. And we're steeped in the values of HHC, well-being, diversity, equity, and inclusion, and obviously the highest rigor of psychiatric practice.
Each rotation is a little bit different, but residents can expect to have supervised clinical experiences, encounters with patients, families, exposure to interdisciplinary team approaches, as well as protected time for didactics, individual supervision, and scholarship.
We actually rather pride ourselves. We're kind of willing to take almost any sort of patient. So I do find, or have found in my career, that many locations and units look for ways to say, no, this person's too old, too young, too tall, too short, too whatever. We are much more open to accepting anything. We'd like to have the belief that we can handle pretty much any patient that comes our way.
It's just so interesting because it's really a reflection of the catch area and the communities we serve and how they don't have any other resources for hospitals, so we have to see everything. And so the exposure you'll get here is beyond what you would even see, in a larger institution, I would argue, and you get to be more hands-on with it. So it's a huge, huge benefit that we have up here.
We really do work as a team here, and there's a lot of collaboration and camaraderie that goes into the patient care. And we really value each other's opinions, and it makes it a wonderful place to continue to work and grow.
I think the camaraderie among the staff is really awesome. I think there's a definitely family orientation. We really try to be supportive, try to be open-minded about different things that people may be working through or talking about or concerning to them.
There's interdisciplinary team involving social workers, case managers, nursing, the medical director, associate medical director, mid-level providers, where we all come together to discuss all of the patients, try to understand them in a holistic sense, not just the diagnosis, but in the context of our community, their families, to really create the best treatment plan that we can to get them feeling better and sustain that improvement.
I think some of the most important traits in the residents that are prospective for our program are enthusiasm to learn, curiosity, openness to alternative perspectives and points of view, and just a passion for patient care and psychiatry in general. Residents
training here will have really unique educational experiences and opportunities in multiple settings in Connecticut. There's a really clear mission to serve rural and underserved populations, as well as have lots of individualized learning that will help each resident focus on what they'd like to do once they're ready to graduate.
Being able to serve as a leader and create change and be part of this residency program where we're going to be working with the newer generation of psychiatrists that will potentially be in this area. It's an exciting thing.
I'm confident that our program will stand apart in the heart and soul of our psychiatrists that are a close-knit group of collegial practitioners. I think that we stand apart because of the values of HHC and serving the underserved being the mission of St. Vincent's going back over 100 years. I'm really confident that we're going to have an excellent program.
I think there will be a lot of very much personal, one-to-one, ongoing interaction with the faculty, which I'm not sure you necessarily get that in a larger program.
There's been lots of changes that happened within our field of psychiatry in the past half century. There's a big evolution. There's still so much that's not known, and it's a constantly evolving field, which I think, being in psychiatry in this time it's an exciting period.
There's a lot of innovation that is going on in our hospital systems as well as with the Nutter School of Medicine, and they'll have access to all of those opportunities.
They'll be ready to go on to all levels of other training or practice in any field they so choose within psychiatry.
My hope for having psychiatry residents here is that we expose them to a community hospital and the needs of a rural community.
We hope our residents will plan to practice locally after graduation, but we want them to be prepared to be well-rounded psychiatrists that can practice in any setting in any part of the country.